Mr. President, we're on the cusp of a historic bill today, bipartisan bill, that we took a different approach thanks to Republican leadership, where we put the leaders of each of the committees, both Democrat and Republicans, to focus on their portion of the needs behind this COVID-19 crisis. Before I get into my remarks today, though, I want to remind the colleagues here today that we have sponsored a resolution recognizing and thanking all the people in America who are stepping up and, as others said, put their own health and their family's health at risk to make sure that their neighbors and friends and patients and business partners are taken care of. I'm talking about supply chain people, healthcare workers, transportation workers, all the people in the country, ag industry, all the people in the country who are keeping the essential needs of our population going. While restaurants are closed, they have takeout services, even here in Washington, D.C. That is not an easy thing to do for those folks. It's a loss leader. They're losing money on it, and I wanted to make sure that we recognize in the midst of this crisis how Americans are responding. Americans always respond to crisis in a better way than anybody else in the history of the world, in my opinion. Sometimes we're not always the quickest to recognize that we're in a crisis, but right now we are responding to this one right here before us. As a matter of fact, Mr. President, I believe we have two crises today. One is obviously the medical crisis, the healthcare crisis that we now are characterizing as COVID-19 virus. We know how it originated, and we know now what other countries are learning from that who are ahead of us in the cycle. But because of that, we have a connecting economic crisis that we're trying to deal with in this piece of legislation today. I hope we can get this done tonight. I don't see any reason why we can't. We have a deal. There are some questions here in the last hour, but I think we'll get those done and hopefully get this voted on and get this voted on tonight. As we deal with these two crises, though, Mr. President, it's my suggestion that we look at this, how we address dealing with this crisis in three phases. One, we're in the middle of the first phase right now, and I would characterize it as mobilization, where we're identifying the severity of the disease, we're identifying who is the most vulnerable, we're identifying what we need to do to deal with it, and we're mobilizing behind that. We see a dramatic increase in the number of tests, thanks to Vice President Pence. We still have shortages of testing kits and swabs and reagents and even testing machines, but we have things like in my state where one of our major hospitals, Emory University Hospital, has their own testing. They can do it in a matter of hours versus days, and they're making that available to other hospitals in the state. This is all hands on deck. And they'll probably lose money doing that, Mr. President, but they're willing to do that. We have an apparel company in Georgia who has now shut down their business in apparel, and they have good orders, profitable orders. They're putting those aside to make masks to try to help fill the need there in those shortages. But the mobilization phase is where we are today. We're identifying, based on the experiences of other countries, what we might expect here. We have hot spots in our country, just like other countries have had. We saw what happened in Wuhan and Hubei province in China. I've been there. It's a very old population, older population. They were late getting to the identification and treatment and isolation, and we see the repercussions of that. But what we can learn from is that they are ahead of us in the cycle. However they dealt with that in the early days, we see now how they have dealt with that crisis and what's happening to the numbers, and we can learn from that. And I'll talk about that in a second. The second phase, though, is transition, and this is one I'm not sure we're in it yet, but we're about to go into it, partly because of this package, and that is to make sure that we protect the parts of the economy where we can, so that when we do start to come out of this, just like every other country ahead of us in the cycle has done and is doing right now, that we'll have our businesses in a position to reconnect with the employers or employees that they've worked so hard to develop. And then, of course, the third phase is full-on recovery, and that is to do the things then to get the economy back on its strong footing, to make sure then we address the shortages of what we found in our current preparation for this. For example, we didn't have a strategic stockpile of some of these essential medical essentials that we needed in the identification, testing, and treatment of this particular virus. That recovery will take some time, but at the same time, the way America always responds to this is that I believe we can respond very quickly if we get the transition phase correct, and that's what I want to talk about today. As we look at the medical crisis, though, we understand now through a lot of data outside of the U.S., and I will caveat this, that each country's experience is just a little bit different. I would also comment that there's a lot of noise in the data that I see around the world right now. The medical community is doing a great job of trying to aggregate this data to see how it applies to our needs here at home. I give our doctors and nurses and caregivers the highest thank you I can for what they're doing here and all over the world for that matter. But what the experience is in Italy might not be the same as it is here. The experience in South Korea might not be the same as it is here. So we have to look at those and be very careful that we don't try to extrapolate either the severity or the lack of severity as being applicable here. This particular, what we do know though, before I get to the bill, is that in the World Health Organization just this week has published an update to their numbers, and they're characterizing this disease this way. And look, every country has a little bit different infection rate, a little different mortality rate. I believe the United States, because we haven't tested as broadly as some of the other countries like South Korea have done, we don't know what the denominator is yet, so we really don't know what the mortality rate is or the infection rate for that matter. But this is what the World Health Organization is doing. Just to put this in perspective, that about 80% of the people infected with this COVID-19 virus will probably have a mild, that's the way they characterize it, a mild experience with this disease. 15% will be serious enough to go to a hospital particularly, and then of that 5% will be critical patients, typically generally toward the more vulnerable patients, elderly, people with respiratory existing diseases, and or potentially immune deficiencies. As we deal with that medical crisis, and we've poured a lot of resources toward that in the first two phases of help, and in addition to what the President did with his $50 billion allocation earlier. This bill, almost $2 trillion of aid, as we see it, toward businesses and communities and states to make sure that we can weather this storm. This bill, let's be very clear about this. This is not about companies. This is about employees. This is about the people who work for employers, either in their own business or in somebody else's business. This is all about employees. It is merely a financial bridge to get through this period of time to get into that recovery phase that I'm trying to describe here a little earlier. It's about the employer-employee relationship and to make sure that we keep that relationship intact. Look, in the last 3 years, we've created 7.5 million new jobs. Prior to this crisis, this virus crisis, we had an economy that was just booming, created 7.5 million new jobs. We had 7.5 million job openings, as a matter of fact, and only 5 million people looking for work. So we had a situation where we had the economy moving in the right direction, and then this hits, and we want to make sure we don't lose any of those jobs. And for that reason, we focused on the employer-employee relationship. Yes, we plussed up unemployment benefits for the state so that they're not overwhelmed, but we made sure that the employer had the liquidity to keep these people employed. And in that vein, we did not want to have a liquidity crisis, which we could very well have right now because of shutting these businesses down. We didn't want that liquidity crisis to turn into an insolvency crisis. We can deal with a liquidity issue. It's very difficult to come back and deal with companies that have gone insolvent and are now in bankruptcy proceedings. That is a very long and difficult process. It's difficult to come back from. We do not want to do that, and that was the primary purpose of most of the facets of this bill, some $2 trillion. I'll say this about that. There are two major components to do that. One is a small business contingency. Now, a little over 50% of the people who work in America work for companies that have 500 employees or fewer. That's a new learning for me. That's changed dramatically. But it is the engine. This is not new news. This is the engine of new job growth. We know that in the last 3 years. Well, we have $350 billion directly targeted toward those small businesses, who can then, by the way, go to their existing local banker and get this facility done, a government-backed loan guarantee. In addition to that, there's $454 billion directed at other businesses, plus another $58 billion towards strategically important industries like our airline industry and so forth. And again, most of this money is in the form of loan guarantees to provide liquidity to keep the employee employed with their employer. It's no more difficult than that. But one other thing that's not being talked about, and I want to highlight this, and that is $454 billion is historic. That's a lot of money. But it has the ability through the Treasury that they can actually lever that up in terms of the way that the money goes out to banks. It can be levered up to $3 or $4 trillion. So what we're talking about here is the potential of up to $5 trillion of liquidity into our economy. This is historic. It should be enough to shock the system to see, okay, there's going to be liquidity there. There may be some growing pains in the early days, but the liquidity is going to be there to weather this storm, to bridge this crisis. I want to look at what's next. Talk about this transition phase and maybe even the recovery phase for a second. The first thing we have to do is we have to really learn from other countries that they're ahead of us in the cycle. For example, it took about 6 to 8 weeks for China, even with their mistakes, it took about 6 to 8 weeks to go from 0 to their maximum number. But we know that the disease has a life cycle. If somebody is infected with it, if they survive, they come on the backside. And so far, there's over 70,000 people that have had the disease in China and are healthy now. We know from anecdotal evidence on the ground that about 80% of the employed workers in China are beginning to go back to work, and almost 90% of factories. This is outside of Hubei province, outside of Wuhan and Hubei province. They're going back to work. In South Korea, the learning there is testing, but more than that, they also track contacts. Now, there are 50 million people in South Korea. We have 330 million. It's a little different here, but in certain cities and states, they can certainly look at doing that. So we have to learn from countries like South Korea and Japan, Singapore, Hong Kong, Australia, and even China, because they're ahead of us in this cycle. We should be in the first few weeks of this cycle going from 0 to whatever our maximum number is, but it's the number of active cases that's the most important, not the number of total cases. So the mortality rate is yet to be determined because we don't really know the denominator. But I believe if we can test more, and the acceleration curve, according to Vice President Pence, is underway right now, that we will have that ability to do. Contact tracking is another, and then isolation is another one we have to think about, unfortunately. We have hotspots. In the Ebola crisis in Africa, what we learned from the medical community was if they could put a full court press on the areas of flaring where we had the disease flare up and isolate it where they didn't have people traveling outside of those areas. So isolation by geography and demography are unfortunately called for if we're going to do everything we have to do to control this disease in the time frame that we should. The third thing I'll highlight briefly is I believe right now this shows that we were behind in terms of our preparation for a pandemic like this. There's no question about it in the country and the world. We can point fingers and blame. That's not my purpose today. What I want to talk about is this. In America, and if we can bring the world's resources with data, this is the big thing. We have limited data in the United States. There are other countries that have a lot of data. I believe if we aggregate that data and create a Manhattan Project type effort to go toward vaccines and treatments, that we can absolutely be ready for flu season next year if in fact this particular COVID-19 virus has a seasonality. We don't know that yet. In conclusion, Mr. President, there is no question that this is a moment of challenge in America. I will say this, that President Trump, for all his detractors, early on stepped up and was a strong leader. I said this several years ago. He reminded me of Winston Churchill, irascible but effective in getting results. And that's what we've had early on. Right now, we need a steady hand to make sure we don't kill the economy while we kill this disease. And my only point is in this transition period, and nobody has all the answers yet, we need to start asking the questions of what can we do in this transition period to find a balance between protecting life and protecting the economy long term so that when people get well, they'll have a job to go back to and we'll have an economy that can help the world prepare for the next pandemic that we're talking about here. The American people have the best spirit, I believe, in the history of the world when it comes to dealing with this crisis. I've talked about a couple examples in my state. The airlines right now are another one. I know that Delta is one of the primary airline carriers we have in the country. They're keeping some flights on. I know I have a reservation on a commercial flight later this week, and I asked my assistant, you sure I can get a seat on that plane? She said, yeah, there are only 5 people who have booked a seat on that plane. So it shows that people are trying to do their part here. Neighbors, people going to grocery stores for their neighbors, taking care picking up mail, doing anything they can to protect the people that are at risk. In small communities, we know how to do that. In major cities, it's more difficult, but it's even possible there. I'll conclude with this, Mr. President. There is a day coming, and it's not that far off, that we'll be behind the top end of this curve in America. We will have lost some lives. That's unfortunate. We all regret that. But what we have to do now is to make sure we prepare ourselves for this transition phase, that while we're coming and still dealing with people who are getting the disease is on the wane, and the economy needs to be brought back so that we can make sure that we can prepare this country for the next round that we may or may not see in the future. With that, I yield the floor.